This is where we being a little bit more targeted here. So we start tapping on the side of the hands. I always do 2 rounds. And now this number could change. It could go down, it could stay the same, or it could go up sometimes. And there's no wrong or right. There is something that we call this processing. So, you know, when we start focusing on the feelings, we're exposing that feeling. So let's say some of you identified that hidden thought that is there, but I don't really want to think about it. But now nervous system calm down a little bit and say, well, now I'm ready. I want to actually have a look at it. So let's say there is a thought at the back of a head that brings us a anxious emotion. So we are becoming a little bit more targeted at it. And that's the exposure part of EFT. So we're actually being very specific. So let's say the thought is the worry of the scan results that I'm having next week, right? So it's there. I don't want to think about it every day. Yeah, I want to do stuff to numb that thought, to not to look at it, but it's there. And that thought's going to be coming up and creeping up at you in unexpected times, usually, you know, during the night, first thing in the morning. It will creep on you, you know, when you're doing something that you don't really think about much, and it was just like, I'm here, so you better look at me because I'm not going anywhere. I'm still here, right? And that thought creates an emotion. It could be a fear, it could be anxiety, fear of so many things that we don't need to go into those things, but there is a fear. And that fear usually feels somewhere, probably your chest, maybe stomach, maybe your head, it doesn't matter. So with this, we say words out loud. So I will say it. You don't have to repeat after me, just keep it in your head. So we'll say, even though I have this thought and it makes me anxious and I can feel that anxiety in my stomach, right here, right now, I'm safe. Even though I have this thought and that thought makes me really anxious in my body, I can feel it. I can feel my tense body. I can feel this feeling in my chest. When I think about this, right here, right now, I'm okay. So even though I'm thinking about this, or even though this thought sits at the back of my head all the time, and it makes me feel scared, makes me anxious, right here, right now, I'm okay. And I accept this is how I feel. This is how I feel when I think about it. So it's you not accepting the thought, you accepting yourself having the fear when you think about the thought. So that's the exposure. Okay, and then we start tapping at the beginning of the eyebrow. So routine goes exactly the same, but now what we do, we say how that fear feels. We go, this fear in my stomach, on the side of the eye. Or if there's a heat wave, you go, this heat wave of fear or anxiety in my body. Or whatever you identified. So if this is a tension in your arms, you will go under the eye, this tension in my arms when I'm thinking about this thing. Under the nose, or this shortness of breath when I think about this thing. Whatever that was, you just bring a little bit more attention into how that manifests for you on the chin. And just keep breathing to it. And let your nervous system, because that's what we're doing. We're looking at the thing, the thought, the sensation that creates a response in the nervous system. And the response in the nervous system, we need to do something about it. We need to run away or we need to fight. Or if we can't do anything and it's too much, we will freeze. But there is a response. So the tapping, the motion of tapping, tap on the collarbone, the motion of tapping, this somatic aspect sends electrical signal into our amygdala that is responsible for alarming the nervous system, saying, even though you have this thought, even though that thought makes you feel this, right here in this room right now, you, nervous system, can calm down. It's okay. So you start now thinking about the future and not having this nervous system response that disadvantages you, right? Because we know if we're in fight and flight, we'll produce cortisol that links into, inflammations in the body, right? We will feel pain more. We won't think clear. We produce adrenaline, testosterone, all the hormones that are actually doing disservice to us. So what we want to do by tapping while we're seeing the issue, down-regulate your nervous system. You don't need to produce cortisol. You don't need to fight or flight. You can face this adversity, whatever that is, with the calm, collected, you know, and connected body under the armpit. So that's what tapping is about. It's about exposing yourself to the fears and anxieties in a safe way on the top of the head, because no one's going to take away that scan that is coming. No one's going to take away, right, the different results of it, but we can down regulate our nervous system to the point in which we won't be in that fight, flight, fear response. Okay, take a nice deep breath in and out. And now measure again what's in the head, what's in the feeling, what's in the body. Is it changed? Go down, up, stay the same. There's no right or wrongs in here. So that's in a nutshell what EFT can do.